Hello and welcome, Cardiology Update, viewers, listeners, and readers. My name is Dr. Shadi Reyes. I'm a cardiologist at Detroit Medical Center, director of the cath lab, as well as rehab and Detroit, Michigan, United States. Today, I'm going to coming to you with another article, very interesting, talking about high-risk intervention and the role of mechanical support and patient undergoing high-risk intervention. As we know, there is increased utilization in the last few years of mechanical circulatory support for evaluation and support of the patient undergoing multivessel coronary artery disease, left main disease, and patient with low or normal ejection fraction. In this particular study, they highlight, it's called PROTECT-3. It's a registry-based data looking at the outcome of these patients who underwent high-risk intervention. They define it as intervention on the last remaining conduit, patient who has multivessel disease, and also patient with left main disease. They divide the patients into three groups based on their ejection fraction being preserved more than 50%, or moderate 30 to 50%, and those are with severe LV dysfunction, which is less than 30%. In this analysis, there was no comparison group, so basically it was just continuous registry of utilization of a device called impella, which is one of the percutaneous left ventricular assist devices. At the end of the follow-up, they studied the patient from 2017 to 2020, and after 1 year follow-up, they showed there is no increased risk of acute myocardial infarction, need for revascularization, as well as no increase in MACE that I defined as adverse events such as kidney disease, stroke, and vascular complication. This is very reassuring data looking into a single arm of pLVAD or impella outcome in patient undergoing percutaneous complex coronary intervention. Now, this is a very interesting article. Definitely, it highlights that these devices are relatively safe if they are operated by operators who are familiar with the access and closure, especially they require sometimes 13 or 14 French sheath, and which is one of the barriers for operator to usually use these devices compared to other devices such as balloon pump that require a smaller sheath size. Second, I have another limitation on the study, that there was no comparison group to another percutaneous LVAD or to a patient who did not have any LVAD or pLVAD evaluation or without any support. So again, this is a registry-based data for 3 years, definitely showing a positive outcome, but it has limitation, as I mentioned, with no comparison group or no comparing group with no need for pLVAD or those who underwent intervention without percutaneous LVAD. Again, very interesting study published recently. I would like to encourage you, if you are doing high-risk intervention, to evaluate the data. But this is an ongoing topic. We always discuss it at conferences, looking into shall we do mechanical support, and we often see this debate happening again and again. But I think the evidence is there that in these patients who have low ejection fraction, multivessel disease, as well as left main, I think the utilization of pLVAD or impella in these cases is justified to avoid any pre-procedural complication. I hope you enjoyed this video. Watch other videos and others on Cardiology Update, social media outlet. I am Shadi Reyes from Detroit Medical Center. Thanks for being with us.